Hello there, Dr. Dicken Weatherby here from Optimal DX. This is a short walkthrough of why lab interpretation in functional medicine is different work than what conventional benchmarks measure and what that costs you. How long does it take you to interpret a comprehensive blood panel for a new patient? 30 minutes? An hour? And when do you actually do that work? Between patients? After clinic? Sunday night? If you practice functional medicine, you already know that lab interpretation is not a 5-minute task. But the size of that gap and what it actually costs you is worth talking about. A national study of 200,000 ambulatory physicians found that conventional ambulatory care takes about 3 minutes of chart review per patient, 1 hour per 8-hour clinic day. Across roughly 20 patients, that works out to roughly 3 minutes per patient. But that's not your reality. And the reason this is not your reality is the work you do is qualitatively different. Your panels run 60, 80, sometimes more than 100 biomarkers. Your patients arrive with histories that span years. You read against optimal ranges, not just the standard ranges, which require you to hold a lot of range data in your head and be able to convert and translate on the fly. Not just that, functional medicine, by the nature of the work we do, is multi-system oriented, and detailed synthesis is required to monitor, assess, and analyze patterns across functional systems. So the gap between 3 minutes and what you actually do is not a small one. And the cost of that gap shows up somewhere most practitioners do not name out loud. So consider a new patient, 45 years old, fatigue, weight gain, brain fog, and her panel comes back. TSH is at 2.8. Free T3 is low normal. Free T4 is mid-range. Reverse T3 is elevated. Her anti-TPO is at 35. Ferritin at 22. Her vitamin D at 2.8. And her fasting insulin is at 11. And her HSCRP is at 2.4. Now, a conventional read says this panel is mostly normal. TSH is in range. Free T4 is in range, anti-TPO is below the standard cutoff, and the visit moves on. You, as a functional medicine practitioner, read and sees something different. It's a connected story. What we see is subclinical thyroid dysfunction, poor T4 to T3 conversion, possible early autoimmune thyroid involvement, iron insufficiency feeding the conversion problem, metabolic dysregulation, low-grade inflammation tying it all together. Same labs, different question, different work. Now, that synthesis might take you 15 minutes if you're really quick and really good at it, or it could take you up to 60 minutes for a comprehensive new patient. And it's not just slower than a conventional read, it is actually structurally different. And here's what most conversations about practitioner burden get wrong. They focus on time, hours on the inbox, hours on documentation, hours after clinic. But for functional medicine, the dominant cost is not actually the clock. I think it's cognitive load. You are holding multiple body systems in mind at once. You are recognizing patterns across markers that conventional models treat as unrelated. You are calculating ratios, comparing to optimal ranges, integrating the lab picture with patient history. And this is why Friday afternoon panel is harder than a Monday morning one, even when the patient is no more complex. You're not running out of time, you're running out of cognitive reserves. And there are 3 places I think that you already feel it. That cost shows up as the depth versus schedule trade-off you make every week. Every functional medicine practitioner makes this call weekly. Go deep and run late, or stay on schedule and accept that you're going to miss something. Secondly, the 9 a.m. patient versus the 3 p.m. patient. Spend the morning on lab synthesis, and the afternoon patient gets a different version of you. That's a bandwidth problem, not a time problem. Thirdly, inconsistency across the team. Two clinicians reading the same panel reaching different conclusions. The standard of care lives only in your senior practitioners' heads, and most practitioners pay this cost without naming it. The fix is not to read faster. It's to move the synthesis out of your working memory. Optimal DX runs pattern recognition, ratio calculation, the optimal range comparison, and the dysfunction likelihood scoring before you open the chart. The functional health report has done the multivariable work for you. Your job changes. You verify rather than synthesize. You make decisions rather than build them from raw data. You walk into the patient room with a picture already assembled, and the time savings are real. Most practitioners get anywhere from 30 to 45 minutes back per new patient, but the biggest shift is the one that doesn't show up on a stopwatch. You finish the day with cognitive bandwidth left over. That patient at 3 p.m. gets the same thinking as that patient at 9 a.m. You did not enter functional medicine to spend evenings interpreting biomarkers. You went in because the conventional model was missing the patient. And the cognitive work of functional medicine does not have to live inside your head. There is a better place for it. So my recommendation is watch the demo at optimaldx/demo. Then test it on a panel you've already interpreted yourself. Compare what we flagged to what you found. That is the most honest test of the difference.